Hi there, my name is Duke. I'm an intermediate student, and today I'll be doing a medical assessment on this patient right here. Okay, so dispatch information is at 0700. They're dispatched to a local assisted living facility for an 80-year-old female with an unknown complaint. Okay, so first thing first, we're going to ask how much number of patients we have, which is 1 in the scenario. We're going to ask how far is the hospital, which is 20 minutes from our location. We're going to ask any ALS intercept available, which is 15 minutes away from the call. Then we're going to ask for a helicopter, just for in case, which is none due to the wind. Okay, then we're going to ask, is there any environmental hazard we got to worry about, any hazardous stuff, leaks, anything like that? They said no, everything's good. So that's good. So now we're just going to take PPE precautions right out of the way, and then we're going to consider C-spine precautions for the patient. Okay, so we go to a scene, and this is the first you get. You arrive on scene to a trailer that appears worn down with a car with a flat tire in the driveway. As you gather your gear, you notice no one meets you out front. As you approach, you notice a strong smell of cat urine on the porch and appears not to be well kept. You notice the door is propped open and you hear a loud machine which sounds like an oxygen machine. As you enter the scene, it becomes obvious the house is filthy with strong smell of rotting food and animal urine. In the corner of the living room, you see a heavy set of 220-pound male with obvious pedal edema. Okay, so first thing first, we do have our PPE on right away, and then we're gonna come up to the patient, and we're gonna introduce ourselves. Hi, my name is Duke. I'm an intermediate. What seems to be a problem today, sir? And he answers, she complained, shortness of breath, and chest pain. So him doing that shows that he is breathing, which his airway is clear because he's able to talk to us, which is a good thing. Okay, so we do have airway and breathing good. Since he is talking to us, I'm gonna say, sir, I'm gonna check your pulses real quick, bilaterally. He has bilateral pulses, both strong, but they are irregular. Okay, so then we're gonna just ask simple questions for the patient, or we're gonna see what the patient looks like. It appears that when we arrive on scene, we see he has ANO times 4, because he is answering questions correctly. Okay, now we do see that he has paraoral cyanosis around his mouth. I'm like, sir, I see you have oxygen here. You're supposed to be on oxygen. He does say yes, he is supposed to, but he doesn't have it on at the moment. So the first thing I'm gonna do to help him with that, I'm gonna put an hour breather on him, 15 liters per minute, just to see if it helps hit with the cyanosis. Okay, now I'm gonna check his respirators to make sure they're adequate. They are rapid and they are shallow. It's a good thing to notice. He is able to talk to us. We're gonna ask him some medical history. Sir, do you have any allergies? Which he said yes, he is allergic to apples and coating. And we said, do you have any medical history that we should be aware about right now? He says he had an AMI 2 years ago, it's a heart attack. He does have CHF. He had a hernia surgery, does not remember when, and he had GI bleed last year. Okay, and then I'm gonna ask him, sir, when was the last time he had something to eat? He did say his last thing was, his last oral intake was eggs and bacon earlier last night. Okay, so that's good. He did say he was in chest pain, so I'm gonna ask him, sir, when does pain start happening? And then he says, while sitting, well, and then he took out his oxygen. Okay, does anything make the pain better or worse? No. Okay, does it radiate anywhere? Nope. Can you describe the pain for me? He just says he feels pressure in his chest. Okay, and I'm gonna say from 0 to 10, 10 being the worst pain in your life, 4 out of 10 pain. And how long has this pain been happening for? And he says 3. Or it's 3 hours. Okay, and I'm gonna say, sir, do you take any medications that we should be known about? And he says he takes Lasix, Anadol, vitamin D, aspirin, oxygen, metropole, and HCTZ. So since he does have aspirin, he is having chest pain. I'm asking him, sir, have you taken your aspirin today for the chest pain? He said